Hello, everyone. Welcome back to another episode of Take Back My Brain. I am your host, Laurie Hammer, and today I have a very special guest because she's also a dear friend of mine, is Dr. Rebecca Walker. She is a board-certified chiropractic neurologist, and she is amazing. We refer back and forth to each other with patients, clients, and I really think every person that I know should really go see Dr. Becca. So thank you, Dr. Becca, for being on today.
Yes, thank you, Laurie. She pegged it right there. I love collaborating because in the world of healing, nutrition is first. And so when you have a good foundation there, it makes everything else fall into place easier.
Yes.
Less dis-ease, but
Less
still
it makes your job easier if they had better nutrition, for sure.
Yes.
Yeah, it's hard to fix the brain if your brain is inflamed because of what you're eating, consuming, if you're toxic, whatever it might be, mold exposure, that kind of stuff. So,
yep. Well, and the main thing the brain needs is fuel and activation. And if we don't have the right fuel, and especially in today's day and age, we rarely have the right activation or any activation or minimal activation, then we're just set up for failure to begin with.
Right. So food is fuel, but what do you mean by activation?
Activation, primarily movement in general, but you can also throw in good thought, prayer, meditation, all of that with that. But this is my left side. I don't know if the camera shows that as my left side, but this is the left side of my brain, which controls the right side of my body. But anything I do with the right side of my body also has pathways up to the left side of my brain to make sure things are being carried out the way they're supposed to through various areas. And that's with our ability to focus. It's our ability to move our eyes. That's our ability to be upright standing in society, talk, think, comprehend. All of those are movement pathways just in various ways. And so we have to activate the brain in all of those capacities to have that function.
Yeah, absolutely. And we're such an inactive society. Like you really have to be intentional about those activation pathways for sure.
Yes. Yes.
Yeah, especially with our kids. I know your kids are so active. My kids have always been active. That's just always been a priority.
Yes.
I know even my daughter says about your kids, like they never stop moving.
No, which is sometimes when you compare it to other people's kids, which don't compare your own kids, but you sit there and go, what's wrong with my kids? They're not hyperactive. They're just active in a very unactive world.
Right.
So.
Yeah, it's just not the norm of what we normally see. But
Yep.
it's normal to be active, and your kids should be wanting to do all sorts of things and move all day long, right?
Yep.
Yeah.
We are called to move, and that's how we learn. This isn't a learning podcast per se in regards to homeschooling, but I haven't pushed heavy education because their brains aren't there yet. They learn by manipulating their fingers. I mean, that's why babies bring food to their mouth, is the biggest integration to the brain is mouth and hands. And so they're learning by doing this. Then we learn by playing and molding our, now we use Play-Doh. Before it used to be just go play in the dirt.
Right.
But the more they can manipulate their body throughout the world, the better that brain is now adaptable later in life.
Right. And they just naturally learn that way, right? And we naturally understand, we get our critical thinking from doing those things when we're little. And we're missing a lot of that today. So
curiosity drives movement.
Curiosity
drives learning. And that's what we fail to have curiosity, or we have a quick answer all too easy, or a quick result for a kid to, oh, you're bored, here you go, versus go be curious and find something to do.
Google's not great, right? I mean,
no.
It takes away the curiosity of everything. I mean, you're curious because you're asking Google, but you're not actually finding it out for yourselves.
Yep.
I know when my kids were little, they would go off and play, and I would go into their rooms or the basement or outside, and I'd be like, oh my gosh, they just created, this like pulley system and all these crazy things. And we didn't learn about that. They just figured it out on their own. And just, it's so great. I love the creative brain. And that's what we're going to talk about today is the brain.
Yes.
Because this is Take Back My Brain. And Dr. Becca, being a chiropractic neurologist, I really want to dive into concussions today. Because it's a big topic. It's a very misunderstood topic. And I don't believe our kids are getting the care that they need when they have a concussion. And there's reasons for that. So thank you for diving into this with me today. I think it's a
Yes.
big topic. Yeah. So I guess first of all, how would you define a concussion?
Oh, that's a good question. In one of our courses, we had to actually go through papers upon papers upon papers about the definition of concussion, and it's inconclusive. You cannot put your thumb on it and say a definitive, this is concussion. But typically, we see change in brain function, and that might be out of balance, or their eyes change, their thought process change, they're now nauseous. There's been a change to the brain in function capacity that we cannot explain in a different I'm not going to say that word, symptom pattern.
Etymology? Yeah.
Yeah, thank you.
Sure.
And so you still have to put okay, could it be whiplash? Could it be an illness? And that's why they're having these symptoms versus, yes, typically it's a blow to the head. Um, or even just it can be whiplash and that
Yeah.
quick motion because the brain is hitting a hard surface and hitting a hard surface. But it's the deduction of what isn't there that then puts you in the category of concussion.
Yeah. And just for the listeners, one of the reasons I'm passionate about this is because of my daughter. She had her first concussion when she was 6, and we were doing a homeschool event at a school, and this young man she was coming out of the bathroom. The boys were running down the hall, and she was 6 years old. He was 12, and he saw her, and he didn't want to knock her over, so he tried to hurdle her, right? Because that's what the 12-year-old brain boy does, right?
Yeah.
We'll just hurdle her instead of just moving out of the way. And his knee caught her chin and sent her into the
Yep.
cement floor and knocked her out cold, right?
Yep.
And so she was 6. And initially, I'm like, okay, what do we do? But she was fine that day, no throwing up. She didn't have a headache, this and that, whatever thing. 2 days later is when she's like, my eyes are fuzzy, and she stopped reading. Like she was on, the 6-year-old reading path, and she stopped being able to read. And it took us a long time to get that back. And of course, I didn't know Dr. Becca at the time. I didn't know any other chiropractic neurologists. So we did a lot of what we could do, cranial sacral therapy. Of course, she already had a good diet. We did, other types of therapy. But she didn't really present typical, right? And
Right.
so sometimes concussion doesn't look like what we've been taught. Like you're vomiting, your eyes are like crossed, and you feel
Right.
dizzy right
Yep.
afterwards.
Yep.
It can start, a few days later. So I love the
Yep.
fact that you bring that up.
Yep. They kind of give us a 72-hour window to some of the acute stuff, but also upwards of a week.
Mhm.
Majority of concussions, in theory, will resolve within 2 weeks. But I always say that's your brain, that's your function center for everything. Why would we want when we have found things to help improve our outcome? And in general, if we're wrong and you didn't have a concussion, it's still going to help your overall wellness regardless. So why not put that into practice to help decrease? I have a child with a brain injury. I'd rather not have to deal with the day-to-days of that if I didn't have to. And I'm not one to put the fear of someone in anything because God's in ultimate control in the end. And we see the blessings and his kindness through it all regardless. But we have found there are things you can put into play in that even 2 week or initial so many days.
Right.
Old theory was rest. Don't move, just go to a dark room and rest. And that is very not evident anymore in the literature. Movement to their capacity is what they need to do. So they need to listen to those symptoms. So if headache is something they have, they can walk ideally 4 times a day, upwards of 15 minutes, as long as that's not increasing any of the symptoms they had.
Right.
It might be we walk for a minute just to get movement. We're walking to the bathroom, walking back. Different things, and each concussion does present differently. Your daughter's was eyesight and in various things. I have a huge concussion flow chart of all the various body systems that it affects, and acute versus chronic. And we're seeing a lot of chronic in our world right now.
Yeah. Yeah. Well, and I knew you when Karina had her, this last concussion. And when she got, thrown from the horse, and we saw you the very next day.
Yep.
The very next day. And I think that made a huge difference because it was definitely some cumulative issues that we didn't really know that we needed to take care of, from the previous concussion. And yeah, anyway. So
Well, and also I mean, you say cumulative, yes, but in general, any injury, we
Yeah,
naturally compensate. And so the compensation pattern sets in almost immediately. If we can break that
such a good
compensation
point. Yeah.
pattern, we're able to aid in that healing continuum quicker.
Yeah. Yeah, absolutely. So how would you diagnose a concussion if somebody came to you? Like, how do
Yep.
we know that when somebody is assessing our child, how do we know that they're actually looking at them correctly? So if you're listening to your athletic trainer, this is nothing against you. I'm just using
Hmm.
this as an example. But okay, the athletic trainer says he's fine,
Yep.
but you're noticing things that are not fine.
Yep.
So how do we know what's right and wrong?
And to a untrained eye, and some athletic trainers know enough to be dangerous, which is a good thing because they then know, no, get them in Becca's office.
Yeah.
I
Yeah.
have one in I think he's the one that does Humboldt and Emmitsburg and Algona, or maybe there's more than one, but that gentleman knows to refer when it's been a concussion because he knows that the kids are going to get better rehabbed and back on the field. Um, I'm
Hmm.
a rub some dirt on it type of mom, but concussion, I make sure I educate the parents that we're not ready until we're ready and don't push this because then we
Right.
have such a domino of further effects. And so in office, typically I'm not seeing them as quickly as your daughter.
Right.
It's usually a few days later. My subsequent concussions are coming in a lot quicker because they've seen what
Right.
we can accomplish.
Yeah.
But now we're two concussions in, whereas we wanted the first concussion. So I'm honestly usually not seeing someone until they're past that 2 week window that we already know, okay, we're not healing.
Yeah.
And so my assessment is always starting with cognitive. I'm talking to them, talking to mom, dad, or another significant other, because if there's personality changes, I need to know.
Hmm.
The affect of someone changes drastically when the brain isn't firing as well and when it's damaged and trying to heal. So that makes a difference. So a thorough history is definitely step one. And oftentimes the individual with the injured brain isn't giving the best history. So it's
Right.
helpful to have someone else there. And then it's a balance assessment. It's a balance assessment with various movements of the head because of this vestibular system, but then also proprioceptive input from the neck, because those two are very integrated into what the brain is telling you.
Yeah.
Certain eye movements, quick eye movements, slow eye movements, quick head movements to see if the eyes can stay on. And then sensory motor, your basic overall exam as well. The pupil response, those type of things, like that is a pretty thorough exam. I went in a very more in-depth course of way more exam stuff that you can do, a lot of intake forms, that kind of stuff. That's more of your chronic condition though. So someone who really hasn't resolved, then we're going to dive deeper into what specific areas are most affected by this and how can we rehab that. If it was initial onset on the field, there's different things that they should. Balance is huge. Balance is the number one thing. So if they say my bell got rung and I lost consciousness and you stood up and came to and they didn't check your balance, yeah, we should probably do that.
Right. Right.
So that's number one. Anyone should be able to do that quick assessment. If they're tipping over, leaning tower at Pisa, we know something's not quite right. Now, balance is also one of the first things to, in theory, resolve. So if it's not a trained eye seeing that, we might miss out on some of those minor changes.
Hmm.
Um, there is benefit to a pre-concussion screening because then if you're an athlete, we know where you were and where you are not any longer. And so there are protocols that we can follow with that. And then your athletic trainer or coach should be doing a SCAT 5 or 6, which again are really only specific to the first 72 hours. Some places will do it upwards of a week, but it's less precise. And
Hmm.
then you have to really fall into your physical exam at that point.
Right. Right. So if say our child we think they've got a concussion, what is something that we can do as parents immediately following that? So the athletic trainer says, yeah, I think we may have this. Like, what would be the next thing that you do?
Make sure they're eating a good, nutritious meal
Okay.
to their
Explain what
ability.
that is.
Okay. So, um, healthy fats are one of the best things for the brain. And so I always say that Supplementation, magnesium is another good one. There is a list of supplements that people don't always have that one, but
Sure.
magnesium threonate is more specific to the brain. So we want to probably aid in that. And then encouraging movements to their capacity. So those would be like, let's get them fueled and let's get them activated to their ability. With that, with parents though, sometimes we look at our kids and we're like, you're crying wolf, like you're not hurt, because we can't see
Right,
the
right. Like,
injury.
how do we know?
If we break a bone, we can see that that's injured
Yeah,
and we can see it on an x-ray and then it heals, and then they still have to rehab it because it hasn't been being used the same. So
yeah,
that's an easier thing. I have to tell parents, like, your kid's brain, and usually legit concussions, you can tell by their personality. They've just lost
yeah,
motivation, or they're more
yeah.
cranky, or they lost that light in them. And so typically speaking, once they're about 80% better, they've kicked out of that. And so parents are like, okay, we're getting there.
Right.
Like we are.
Yeah. I know a couple weeks out from this last concussion with my daughter, my son was here and he's like, why is she so grumpy?
Yeah.
Like, and she honestly, she's like, I didn't realize I was grumpy. She
No.
didn't have any real perception that that was what her personality was.
Well, because they're in survival mode. And
Yeah.
so any extra little bit of uh, feedback in, or input, noise, light, all of that is sometimes too much for them to dampen out. So any little thing is putting them at their threshold. And so they're going to overreact
Yeah. And
without realizing they just
without realizing.
overreacted.
Yeah.
Yep.
So people, be patient. If this isn't what they typically do,
Yes.
know that they just might not know that they're, overreacting that way.
Yep.
So it does take a lot more patience. So in the days, weeks following the concussion, so watching for personality changes, making sure they're getting good food, getting them movement. What if we're not seeing those things resolve?
Mm-hmm.
Like, I would come to you right away. Is that
Right.
when you would say, hey, you probably
Yes.
need to, yeah, and to not just think that it's going to, they're going to grow out of it, or it'll
Yep.
just eventually go away? Because what really are the long lasting ramifications if you don't do anything with a concussion?
If you don't do anything with concussion and the body's not going to heal itself, we're dealing with brain fog later in life, which then, do we say brain fog versus leaky gut versus, I mean, it's it's inflammation in the body that isn't resolved, right? And it causes a cascade of issues. Learning changes. So we won't say disability per se, but just the ability to focus in school, or
Yeah.
focus at work, or focus with your kids and be present, it changes drastically the more our brain continues to age. So when we have youth on our side and we can rehab that, it's less likely it's going to become an issue later. They see as much as even bowel changes, back to even that
Oh, yeah. Yeah.
gut brain connection. So bowel changes, chronic inflammation, anxiety, depression, lack of wanting to be in social settings anymore. Their apathy is gone. And so those are more those chronic situations, sleep disturbances that they never had in the past that has now shown up later in life. And when we're not sleeping, then we have other health issues that can arise. And so it's truly a domino of a lot.
Right. Right. So it really behoove everybody to just go get checked.
I think so.
I,
Yep. And I'm pretty honest with a parent, like, they're pretty neurologically sound. I think this is a good bruise and we'll overcome it. Or they have great research on hyperbaric oxygen immediately.
yeah.
So the protocol with that is get them in twice a day for an hour. We want 4 hours in between to really help the body actually absorb, facilitate, and comprehend what we just did to it. But if we can get oxygen immediately following an injury, and this is, yes, specific to concussion, but I'd say for any injury, we can bring that area that is now inflamed, not allowing the best perfusion of blood to it. We can allow that oxygen because it's shrunk in size and now perfusing oxygen throughout every capacity of the body, and it can really heal. Dr. Harch, he's out of New Orleans, has done phenomenal studies with this, and I believe it's a SPECT scan, so you can literally see the changes in the brain as they've gone through hyperbaric oxygen. But they have found that if you do 10 hours as quick as you can, so that looks like ideally 2 hours a day within 5 days right away, minimal lasting concussion changes.
That's amazing.
Now, someone can always argue, well, how would you know if you never did it? Well, they've been able to have enough concussions that never had it to now
Yeah.
utilizing it. And it's not a side by side comparison, no, but in the sense of brain health, who cares?
Right? Yeah.
I'd
Just
rather
get
err
there.
on the side of health.
Yeah. 100%.
Yeah. So hyperbaric oxygen is huge. There's a lot of great literature with low level laser.
Yep.
And so in office, we utilize a level 2, and it's the company specific as Erconia. And they've just done a phenomenal job of a lot of studies out there
Yeah.
that they can substantiate with the benefit of. But in general, red light has so much research for brain health. I mean, Alzheimer's is
Yeah.
just picking that up drastically. And so it's really neat to see. I use laser in the office as a pre-post test. So someone's balance is bad, I'll put it on the cerebellum that seems to need the assistance, and that light hits and it activates the mitochondria and it makes the cells work better and faster and heal, decreasing the inflammation and potential pain. And all of a sudden we retest after a minute of that on there and their balance is better. And the parents are like, what did you just do? Like, you can't make that up.
Can't make that up. Yeah. That's not psychosomatic.
Nope. Now there's other things, there's other modalities, various touch things that I'm going to do, or movement patterns that they have to do, or eye things, or, Sudoku is something I often give some patients, and different things depending on which area of the brain was most affected. And so they will get a specific treatment protocol going forward, or at home care plan, I should call it, as to how to best heal from their current concussion. An athlete going forward, if the heart rate increases and it keeps causing the symptoms to come back, typically headache, but maybe it's dizziness or eye issues, we oftentimes can do what's called the Buffalo treadmill test. So we can administer a test and find out, where is your heart rate at and where should it be, and do you have some of the symptoms, and then rehab you accordingly.
Sure.
Most kids don't really need that because you can see it in so many other capacities, but there's tried and true ways to assess.
Yeah. Yeah, absolutely. So we're talking about what to do after a concussion. Are the ways that we can prevent concussions? Because they seem to be, I mean, I know there's more awareness, but there seems to be a lot more concussions now than I remember, growing up, and I just don't remember a lot of people having head injuries. And granted, the awareness is better.
Sure.
But
the awareness is there. Yep. Sometimes I go back and forth on that. Like, they have a lot of research on various head equipment that you can wear and all of that. Now, I don't negate that. They have, if you hit your head, I think it's 1.5 inches or 2 inches. Don't quote me. I have the exact, but if you're hitting your head on concrete, there's varying heights dependent on if it's concrete or a tumbling mat or something else. Like, you have more level of ability to fall and not hurt yourself drastically versus less likely. I think in general, we're less healthy individuals. So we're already going into it at a less capacity. And then I'm going to say, opposite of that, we're also stronger, faster individuals. So we're carrying life out at a higher speed, and we don't slow down. So we are more prone to injury because of that in multiple ways. And so I do think a good healthy diet makes a world of a difference. I think kids being active to start. I always say that I never sprained ankles because I ran around barefoot on the ground constantly and rocked. And so I built up that good firm. So back to the movement of kids and the necessity of movement for our brain. If our brain is adaptable and we can overcome, they actually say someone who has a positive outlook on the injury at hand is actually going to heal. Someone who has a negative outlook, not so much going to heal. And so just our overall, where's our fulfillment and joy leading into a potential injury can make a world of a difference too.
Yeah, absolutely. No, I 100% agree with you on that. Is there a difference between a girl having a concussion and a boy having a concussion?
They do have statistics out there that yes, they have it rated with sports, what's more likely and not less likely, and all the things. You could say boys in theory are more risky, so they're already naturally put in that category of potential because they're doing those type of behavior, those sports. I don't want to say behaviors, but they're in that situation, activities. Hormones, I think, really play a difference too.
Yeah.
You know, a female, depending on where they're at in life and all of that, makes a world of a difference on how we heal.
100%. I would think when
Men,
if you have your concussion as a woman, you know, when you're menstruating would be different than between when you stop bleeding and ovulation, right?
yeah,
I
I
would
think you could put that. I don't know if I've ever come across literature that
I know, but it
points
would
to
make
that, but I think it makes sense. Just knowing how you can exercise and how you exercise differently makes a world of a difference on your body.
right.
That's I think an educated
I'm
correlation
throwing it
we
out
could
as
make.
the Laurie and
Mhm.
Becca theory here.
Yeah, yeah. I don't have the time to study it.
No, I don't either, but we're just going to throw it out there because it seems to play into every other aspect of
Yes,
the female life.
very much so. Yep.
Yeah.
So, yes, there is literature that's more specific as to guys tend to have these symptoms, females tend to have these symptoms. What those specifics are right now, I don't know. It's in paper
Yeah.
somewhere that I have that I could always throw out, but I say every person's an individual. That sure, we could generalize, this is what you're going to experience because you're a male. We could generalize, but that doesn't mean that that's the cookie cutter symptom that's going to come out.
Right. Right. What would you like the audience to know about concussions? You know, kind of like just an overall statement about them.
Um, I'm they're actually happening. I have moms
Thank you.
text me. I have moms text me all the time. Hey, my kid just bonked bad, and what should I be considering? And so I say, you would ask me, what are things that we should be looking for doing? Kids not eating. You had kind of alluded to a lot of that. Not eating, not themselves, not sleeping. There are other drastic things. If they have a runny nose or their ear is dripping, I mean, let's get to the ER and do a CT scan. But typically, we don't need to have to run to that, except for there, unless there's certain things pointing that out. But we have to trust that our kids aren't making stuff up when they're coming to us with things.
Right.
And so that's, I think, maybe the biggest thing is that, yes, concussions are happening at probably a bigger thing, but our body is designed amazingly. Like God wasn't wrong. And so he's given us a lot of the capacity to heal. And so if your kid has a concussion or you feel he might have, even if you didn't have them assessed, but if they're now wanting to eat or wanting to get up and move, let them. Like, let their body tell you what they need in those instances.
Yeah. Yeah. Cause kids they just kind of like an animal. They just intuitively know like, hey, I'm not hungry, so I'm not going to eat right now. Or I want to move now, so I'm going to move. I want to go for a walk, whatever it might be. What about people that have multiple concussions? Like, I don't even know what to ask on that. I mean, because we've covered so much, but actually they're at a higher risk for other things, things happening. Do you just not participate in that sport? But I know people who like they just tend to trip and they hit their head. Or
well,
I have a friend who just hits her head all the time and she's got like I don't know how many concussions.
Yep. With that, I mean, some of that is what's your parietal lobe's awareness of your body in space. So can we rehab some of that to decrease that incident? Some people are just more clumsy, but can we use vibration? Can we use letter tracing, arm tracing throughout the body to make us more aware? Can we do some eye movements? Can we encourage them to read differently to allow them to heal from some of that?
Yeah.
It's one of those, you know, I had a significant injury in 8th grade and the specialist said to me, like, you need to stop now. You're going to have long-term nerve damage. Well, sports was what brought me happiness. Like I enjoyed doing that. I felt like that was movement of my body and performing was part of my calling at that stage in life. Right.
Right.
And I was not fulfilled, you could call it, not playing. And I said, I told my parents I'd rather have the nerve damage for the rest of my life than sit out right now and not know what I could have done. I haven't noticed nerve damage. Like, it might still be there because it was at one point, but the body can heal. And
Right.
so movement in general is still much more beneficial than sitting in a bubble. And so to that lifelong athlete that wants to, be active throughout their life, but keeps getting injured, if it's a drastic injury, we might need to reconsider doing some things to build us up into the capacity to carry out what we want.
Right.
But otherwise, we got to keep moving, and we
Right.
can't be
You can't
afraid of
stop.
the next injury.
No, no, you can't stop for sure. And this is kind of a little veering off of concussions a little bit, but you and I have talked about this a lot.
Mm-hmm.
Just kids in general and how they learn and how the brain functions and develops. And we as moms get so worried, like, oh my
Mm-hmm.
gosh, my kid is 5 and he's, not multiplying 10 times 10. Or,
Yep.
I mean, it'll get a little bit extreme, you know what I mean? But
Yeah.
and maybe just talking to the homeschool moms out there too, but because in school, they send them into a special program, a special program, a
Mm-hmm.
special program. But I have seen working with so many families that have actually taken their kids out of school, all these kids that have been in special programs, they hate learning. They
Mm-hmm.
think they're stupid. They think
Yeah.
all of these things when what if their brain just wasn't ready yet? Can you
Yep.
talk to that?
I can, and very specifically to our family, I'll use. I say God has blessed me with so many opportunities to
Right.
show and share His goodness through the fall of sin. Um, my daughter is 7, and she just wasn't progressing in wanting to understand letters, manipulate them, learn them, sounds, phonics, reading, you name it. She loves when I read to her, but something
Yeah.
was missing. She was the firstborn. She's brilliant, and of course she is because she's our kid, right?
Right. Right. Of
We ended
course.
up taking her to a specialist because I said to my husband, I go, something's just wrong. Not wrong in a bad way, but there's something amiss in her developmental phase. And so she had a misperception of her environment, as simply put, and couldn't progress to reading. And when we pull those kids out of the stressful environment and pull them from pushing them to what they should be attaining versus what
Mhm.
they can attain,
Yeah.
then they actually have room for growth.
Yeah.
That's very evident in the foster care world, trauma.
Mhm.
And a little kid who comes into your home at the age of 5 is acting like a 1-year-old.
Yeah.
Or you might not be able to say that, but when they're in my office and I'm evaluating them, that's what I'm seeing is 1-year-old tendencies. That's probably when their trauma hits,
Right. Right.
via neglect or abuse or varying degrees of that. And so then we have to rehab their brain back at that 1-year-old course back up. So it's going to be a lot of carrying your kid and rocking them, singing to them, those type of
Mhm.
things to help them heal. When we pull kids out of the school and we can now stop and sit and play with them and give them eye to eye communication and uh, encouragement, you're not defined by what you produce on paper, you're defined by God. When we can speak that into our children, all of a sudden their confidence is there. We're naturally healing whatever mishappened. Not that
Mhm.
you did anything wrong, but whatever mishappened, we're naturally healing that without realizing what we're doing
Yeah.
by being present.
Yeah. 100%. You go back to my daughter when she was 6 and had her concussion. I mean, a lot of what helped her to overcome that is a lot of holding, a lot of rocking, a lot of just
Mm-hmm.
touch, a lot of reading to
Yep.
her and not expecting her to go beyond
Yep.
what her capacity was. So me helping her learn was just me reading to her things that she was interested in and she
Mm-hmm.
retains everything, right? And it's
Yep.
getting them involved in something they love. Ours just happened to be horses and
Yep.
see reading progress the better
Mm-hmm.
writer that she became and all of
Yep.
these skills because it does help to connect all of
Yep.
those things in the brain from head to toe. It builds their confidence.
Mm-hmm.
It's so much more than just taking a test or
Yep.
can you read through this little booklet right now at age 6 and
Mm-hmm.
the brain will be ready when the brain is ready. And I
Yep.
think we as mamas just create the environment for that to happen in. And if your
Mm-hmm.
kids are not in the environment that that's happening in, you could change it. You
Yep.
just, yeah,
Yep. Well, and I do say, we're homeschooling now for various reasons. Will we always? I'm never going to say that. I'm never going to say
right.
always. Most likely the trajectory is yes.
Right.
But I might have to bring another mom to speak into my kids' lives. because they might not be learning in that season from me. And that's where having a community of people in your life,
100%.
even when you're dealing with hurt, someone to meet you and just sit with you, right? Like no different than what you did with your daughter. You held her, you met with her, you were
Yeah.
just there. We don't need the answers and the fix always. Sometimes we just need the presence over the platitudes
Yeah.
as adult people, but our little people need that same thing. And that's what we so easily, typically, not maybe easily, but we tend to do as a nurturing parent when we can pause from
Mhm.
the demands of the world. But we need to do that throughout to everyone. And
Yeah.
that's how we continue to heal and progress and now have capacity to learn and grow
Yeah.
across the lifespan.
Across the lifespan. And, you and I believe, you fix the brain first, everything else gets easier to deal with.
Mm-hmm.
Right? And I think that even we've been talking about kids and stuff, but you just brought up a good point, just to creating that community where all of us as moms and stuff and women can support each other
Mm-hmm.
in this, because I've had head injuries. Nobody helped me with any of those,
Right.
through life.
Yeah.
I mean, and I've talked with, Dr. Cooper, and he's like,
Mm-hmm.
concussions can be chemical, physical, or emotional, right?
Correct.
I mean, where there's really no, like you said in the beginning, there's no definite box that all of this stuff fits into. So recognizing that in each other and being able to support, whether it's nutritionally,
Mm-hmm.
chiropractically, or just, coming alongside and going for a walk or
Mm-hmm.
taking a meal or just being an encouragement, because we have so much discouragement
Mm-hmm.
in this life. And, as you're saying earlier, how you perceive life is how you heal.
Yep.
And I think we need to do a better job of that as women for each other
Mm-hmm.
in our day and age when, womanhood is under attack.
Yeah.
Not trying to make this, a political, podcast at all, but we're kind of like going into that, like
Yeah.
this all
That season.
ties together.
It does.
Concussion is, the main topic, but there's just so many aspects of how do we support our brain.
Yep.
And you've brought up some amazing points today. So I appreciate that.
Thanks. Well, it's a big puzzle piece. It's all
It
the
is.
pieces of the puzzle have to come together. It's never one facet. Um, that's just figuring out the one that's maybe more important is the piece where specialists come in.
Yeah. Yeah. 100%. 100%. Is there anything you want to leave the listeners with?
Oh, I don't think so, except for, I mean, I went out on a walk this morning. It was brisk and it was awesome, but get out and move your body. Call another mom. Like kids chasing in the street are chaotic, but they learn how to stop at the stop sign.
Me too.
And that's a good life skill. And so find another mom, grab her, go with your kids, like show them movement in your day and do it in community with others.
Awesome. I love it. Thank you so much, Dr. Becca. I appreciate you more than you know.
Thanks, Laurie. Have a great day.
You too. Thanks everyone for listening. God bless you. See you in the next episode.